So CAR T cells, obviously a lot of excitement, and I think the excitement is certainly warranted. I do want, there's a lot of hype with that as well, and I do think people need to understand CAR T cells a little bit. I don't think we have any further data except for what I had presented at ASCO a couple months back now. And this was our phase 1 trial with the expansion cohort. And I think the few things which we have appreciated and now recognize is one, BCMA is a great target. And number two, for the CAR T cells that we presented at ASCO, which was the Bluebird/Celgene CAR T cell product, we used 41BB as the co-stimulatory domain. And with that, I think what we found in close to about, it was 42 patients that we treated, we found very manageable toxicity, because the fear was always that we're going to see a lot of neurotoxicity or cytokine release syndrome. And fortunately for us, we didn't see a lot of that. We did see CRS, which was about 70%, but grade 3 or more CRS was seen in about 30% of patients, and not too many patients required the antidote, which is tocilizumab, in this setting. So in general, extremely well tolerated. We were fortunate that we did not lose any patients from infusing the product in itself in that study. And what this translated into was a very, very high response rate. We had a response rate of 90% plus, and these were extremely refractory patients. So these were patients who'd had 7 and 8 lines of treatment with absolutely no other options. And especially in the expansion cohort, they had been kind of certainly penta-exposed, and at least quadruple refractory patients. When I say that, I mean refractory to lenalidomide, pomalidomide, carfilzomib, and bortezomib, and the majority of patients had also seen daratumumab. Whether they were refractory to that or not, one can argue about that, but it's in essence very heavily pretreated patients without a lot of options. What we did see was that this translated into a progression-free survival of about 11 to 12 months. And if you looked at patients, again with this strategy, we saw MRD negativity in the bone marrow, which I honestly would not have expected to see, but we did see that. And folks who had MRD negativity on their bone marrow testing, their PFS was close to 17 months, which is quite remarkable in this patient population. A lot more to learn about CAR T cells actually, because our patients are progressing even after CAR T cells. So what are the mechanisms of progression? Who are the ones where do we need to do more than the one infusion? Do we need to add other drugs? So a lot of unanswered questions. What are the mechanisms of both resistance and sensitivity to the CAR T cells? And all of this work is ongoing as we speak, but it's certainly an exciting strategy for us to look forward to for the future.